You might have seen the news lately about women with breast implants who are becoming ill. Well, here to discuss this very hot topic and serious topic is Dr. Pedro Soler. Welcome to the show, Doc. How you been?
I'm great. How about yourself?
I am well. You know what? One thing that I like about you, you are not shying away from this. You are one of the hottest plastic surgeons in the Bay Area, and this is something that you wanted to come on and discuss. So explain what people are starting to deal with and maybe why they've got some questions in their mind.
Well, I don't think it's something that they're starting to deal with. I think we're recognizing and seeing more and more women coming out with different complaints. When you talk about implant illness, it's more of a constellation of symptoms. Okay. Some women will have their hair will fall out. They'll notice that their brain is a little foggy. They may have arthritic symptoms. So it's a whole there's a whole different symptoms that are out there. Not everyone is the same. And typically the response that they'll get from plastic surgeons is that there are no studies to really support that breast implants are causing these illnesses. And they're correct. If you look at the good studies that have been done, there is no hard data to suggest a causal relationship between these implants and the symptoms that these patients are experiencing.
Well, that's what I like about you. You do not deny the fact that these patients are experiencing this, and I really like that. You're very transparent, and you touched on, though, the studies. You were saying the studies have not necessarily been done to a way where you can really look at these results, and people need to have that in the back of their minds, right? Right.
I mean, I think that, you know, there are studies that have come out, one very lately, which actually looked at a multiple of different studies and coalesced them. And so it had over 100,000 patients and did show some relationship to some of these complaints. However, again, not a good scientific study because the way the data was collected, there's a lot of
elements to it.
Correct. Thank you.
Yes. A lot of elements to it. And what would you say to a patient who's coming in who maybe saw the study and was like, hey, you know, doc, I was going to do this, but now I'm not sure. What would you say to that patient?
Well, I think, you know, the important thing is you treat each patient individually. If a patient comes in and they are having symptoms and they believe it is their breast implants, I think the real thing to do is to advise them, here's what we know in terms of the facts. Mm-hmm. Every day, but again, every day we're learning new things. You now hear more people talking about a type of leukemia or cancer, if you will, mm-hmm. that's associated with breast implants. Mm-hmm. Again, as we learn more and more in the way that, such as with textured implants, you have more inflammation. And is it the textured implants? Is it there's a bacteria that's causing the inflammation? This inflammation is leading to capsular contractures, and then we know that there is a causal relationship between inflammation leading up to cancer. So I mean, there's so many factors here, and then how do you relate this to some of the symptoms?
Yeah.
And it can also cause connective tissue disease with the inflammation that I was.
So the one thing that I'm coming away after hearing you talk is that you are very transparent with your patients. You treat everybody individually, and at the bottom line, you're going to do what's best for your patients, but you also know the facts. You are up on the research, and you're up on knowing what you're doing every day. Is that a fair assessment to come away?
Well, I appreciate that assessment, but yeah, that's exactly what I try to do. I mean, as a physician, my job is to help my patients, whether it be through cosmetic or reconstructive surgery. At the end of the day, the bottom line is to help them. The only way you can do that is by having the facts. I think this is definitely a topic that's very hot, highly contested, even within
medical.
Absolutely, that's a great way to start a fight between plastic surgeons. But I think it's important, and I think that being honest and open with the patients and doing and setting up good studies that actually look at this so that we can start to look at what the factors are and why everyone is different, and knowing that at some point also genetics probably plays a factor here.
So lots going on still. Again, I know you are at the forefront of all of that to keep us updated. Thank you so much for tackling this. And you know what? We want to go ahead and put some information up too. And you do also have an offer. Of course, we were talking about breast implants specifically, but there are some other things there on your screen. If you have any questions, of course, just get a hold of Dr. Soler and his team.